This video provides instructions for using the 3M Bair Hugger Pediatric Underbody Warming Blanket Model 55501 and the 3M Bair Hugger Large Pediatric Underbody Warming Blanket Model 55000 and is intended for clinicians only. The Bair Hugger Pediatric Warming Blanket assists healthcare professionals with managing patient temperature in the perioperative and other clinical environments. Prior to use of the 3M Bair Hugger Temperature Management System, consult detailed product indications, limitations, safety information, and instructions in the provided instructions for use, operator's manual, and preventative maintenance manual. The 3M Bair Hugger Pediatric Underbody Warming Blanket Model 55501 and the 3M Bair Hugger Large Pediatric Underbody Model 55000 are two of the 3M Bair Hugger Underbody Specialty Warming Blanket options. The versatile design of these blankets provides unrestricted patient access. Both blanket models have fluid outlets, which enable excess fluids to flow through and away from the patient to the pad or sheet underneath the warming blanket. This can help minimize fluid pooling on the patient's skin. The blankets should be set up on the operating room table before the patient arrives in the operating room. Contraindication: to reduce the risk of thermal injury, do not apply heat to lower extremities during aortic cross-clamping. Thermal injury may occur if heat is applied to ischemic limbs. Note: in cases where fluid runoff is expected, place an absorbent cloth beneath the pediatric warming blankets. First, open the peel pouch and remove the warming blanket. Unfold the blanket on the OR table. As you unfold the blanket, remove the clear head drapes and set aside for later use. Note the sticker at the head end of the blanket, indicating which end is to be placed at the head of the bed. The warming blanket should be placed with perforations facing towards the patient and with the adhesive strip side towards the OR table pad. Next, once the blanket is positioned, use the adhesive tape strips on the underside of the warming blanket to secure the blanket to the OR table to prevent it from slipping. Then tuck the warming blanket's side or tuck flaps under the mattress or operating table pad to provide stability. The blanket is now ready for the patient. Place the patient on top of the blanket while it is in the non-inflated state, ensuring that his or her head is positioned on the head area of the warming blanket. Do not position the patient's arms out across the blanket. Airflow may be restricted. For the Model 55501, the patient's head must be 3 inches below the upper border of the head area. Apply the clear drapes as desired for the surgical procedure. Use adhesive tape strips to adhere the drape or drapes in a place along the upper and/or lower edge of the prep site and/or over the patient's head and neck. The head drape should be used only if the patient is intubated and ventilated. If a safety strap is used, ensure not to occlude the air channels on the blanket. Once the patient has been properly placed on the warming blanket, it is time to begin warming therapy. Hose ports are provided at either end of the warming blanket for clinician preference. Remove the hose port card from the port you wish to use. Ensure that the card is placed in the unused port. Insert the end of the Bair Hugger warming unit hose into the hose port. Use a twisting motion to ensure a snug fit. A visual marker is located around the midsection of the hose end to guide the depth of hose insertion. Support the hose to ensure a secure attachment. Connect the warming unit to a properly grounded power source. Select the desired temperature setting on the warming unit to initiate warming therapy. Select the desired fan speed, high or low. For questions, refer to the operator's manual for your specific warming unit model. Based on the warming unit model utilized, turn the unit off or to standby mode to discontinue warming therapy. Disconnect the hose from the warming blanket and discard the blanket per hospital policy. Recommends continuously monitoring core temperature. In the absence of continuous monitoring, monitor the temperature of patients who are incapable of reacting, communicating, and/or who cannot sense temperature a minimum of every 15 minutes or according to institutional protocol. Monitor cutaneous responses of patients who are incapable of reacting, communicating, and/or who cannot sense temperature a minimum of every 15 minutes or according to institutional protocol. Adjust air temperature or discontinue therapy when the therapeutic goal is reached. If elevated temperatures are recorded or if there is an adverse cutaneous response in the warmed area. As with any device, it is important to read and understand the detailed instructions for use and safety information. This device is restricted to sale by or on order of a licensed healthcare professional. If you have product questions, please contact your local 3M representative. Call the 3M Healthcare Customer Helpline at 800-228-3957 or visit our website. 3M offers device training upon request.